I myself, singular as one person, I can maybe only affect one other person. But if we work together, we can affect a mass of people.
The communities just needed help. They needed guidance, they needed direction. It wasn't because the services weren't there, it's just they needed a connector. The public needed help, they didn't know where to go. The people that were providing the help didn't know how to get the help to the public. And one of the best places to do that with children is at school.
No one's gonna take care of my kids the way I'm gonna take care of my kids. And so I can't depend on the what ifs or let the stress of bills get to me, or I just have to know that it's gonna work itself out and it's gonna get better. And it's not gonna always be where I'm having to struggle paycheck to paycheck to maintain.
A lot of us are on the same page, and then again, a lot of us aren't. And a lot of parents are very involved with their children and very in touch with what they're doing and where they are, and so they kind of have a handle on it. But we also have a lot of children that are just kind of out here on their own, and recently they've become violent, and I think that's just a lot of that is because they're unhappy. I guess, like I said, at some point you get kind of sick and tired of being sick and tired, or just always just worrying, or just, just feeling stressed, or like I say, fatigued. And so I was like, what can I do about it? Y'all are so silly. And this is what they do. We laugh and they talk and they giggle. And they listen to the music. That's what they do.
It is very stressful, and I deal with it better now than I did before, because before I was stressed and I'm like, okay, I get paid the light bill, paid the rent, I paid the water bill, and then I go through the list of household needs, and I'm probably able to get like half of those needs until the next pay period. And I'm like, oh man, and I try to get the most important things, but then when I think I got the most important things, I run out of something else, and I'm like, I don't have the money right now. What am I going to do?
It's stressful, it's overwhelming, it's hard, and you just cope and deal. Like, if I know that Brayden doesn't like loud noises, so I I take headphones everywhere we go. You know, whatever sets him off, you figure out what that trigger is, and then you try to stop it. Like, who do I go to talk to about that? Who can help me? Who's been through this? Like, where's the network of parents that have already done this? Been there, done that, got the t-shirt type of people that I could call and ask questions or go see, or they can tell me, well, look this up or go see this person. Or I just don't feel like there's a comprehensive nonprofit or group or business or whatever that has everything you need. Who's the best doctor? What do you do when you can't get your meds? What do you do when you can't get the doctor to change your meds? What are the best schools? Who has a nurse on site? Those types of things. I don't know where to go for that. I Google everything.
I think the community would do great to build parents up. The most important thing to me isn't straight A's, it's not perfection, it's a happy and productive child. I know when my kids lose eyelashes, I mean, it's ridiculous, you know. They're the expert on medicine, but I'm the expert on my children.
Porque tienen una enfermera, pero no, a veces no está en la escuela. Porque una vez que me llamaron, mi niño tenía fiebre y estaba vomitando. Entonces me llamaron que fuera por él y que lo llevara a la clínica porque la enfermera no estaba ahí para que lo viera.
I don't know. I guess with this day and time, so much going on, you just, I guess, want to keep them a little closer where you can see them. And I told them, you know, allergies, something you just don't really stay at home. You just don't stay at home for allergies because you're going to have days that you wake up and you're going to be blowing and sneezing and stuff, and then there's days when you feel bad, but then there's days you don't. But it's not a cold, so, you know, you go to school.
Well, if I'm the mom and I work a fast food, if I don't show up to work, I don't have a job. You know, it's not like you're in a professional position and you say, hey, I need to go take my child to the doctor. These people don't have that to offer. And like I say, a lot of them are uneducated, so they're working the less paid jobs. And sometimes they're working 2 of those to just try to make ends meet. So you gotta be at work. So probably taking them to the doctor is not one of the things that's a priority.
Sometimes these parents don't know any better, and they don't know what's an asthma treatment, how many puffs a day they have to take, you know, allergy medicine they don't know about, you know, what's the fever that they're not supposed to take the kids to school. They don't know these little things that we think they're little are big for them.
Convenience is awesome. I mean, I would love, it would be really great to just, you know, if the school calls and says your kids are sick, you can say, okay, and you just walk right into the clinic.
We've had incidents here, you know, playground accidents where kids probably needed to go to the emergency room, but when our parent coordinator talked to the parents, they often were scared to take them.
Sometimes they're just sick and they've been waiting all weekend because they know when they get to school there is a nurse here.
Parents are crying out for help. They just don't know how to and who to get it. They really do need help, and they will tell us, I've been here.
In this neighborhood is parents can get a prescription, but they're not getting any strategies or how to deal with this child's ADHD or bipolarism or autism. You know, they're just popping a pill, but they need strategies. And they need to be educated on their child's disability.
I don't like seeing my kids sick. I would rather take on their sickness for them, and if somebody had to be sick, I'd rather it be me than them, because I don't like seeing them suffer. So I was like, if I don't want to see them suffer, then let's do something to keep them from suffering.
The challenge, I think, for us locally as pediatric providers is how do we continue to do the excellent job we strive to do every day with what we've always been doing? How do we develop systems with very limited resources and very complicated data systems that often don't help us a lot in the actual provision of care? And then how do we educate the consumer about what is important, like what is the value of the things that we do to improve their health care?
We already have nurses on the school sites, you know, and just think if you had not only nurses, but at certain sites you also had a small ran clinic to assist the nurses, you know, whether you had a mid-level doctor or whether you had a doctor at that site, or whether you did telemedicine. You know, there's a lot of things that we could do to enhance the service that's offered to parents, especially with younger kids.
It's hard to make change. Every school is different, every community is different. Every classroom, every student, every parent, they're all different. I would love to see a model where they just open the doors to the community.
If you're talking about school-based services for health, that would be one of those community supports that could help support the family and address it community-wide within the school. I challenged anybody to watch those children face-to-face coming off that school bus and not think about future opportunities. The community should not be identified by those circumstances. The community should be identified by the opportunities that all of those people and those children represent.